talking to you this month from our brand new pharmacy shop located within the hospital. This provides 1,000 outpatient prescriptions a month, is very busy, but gives the opportunity for a faster and better service for our patients. We also stock a number of over-the-counter products which are available again for our visitors, our patients and our staff. This is the first of its kind in Greater Manchester and is wholly owned by the Foundation Trust. So thank you for the staff for actually setting up such a fabulous service, something that is really appreciated by our patients. We are now at the final stages of the Healthier Together consultation document, and I think you know that I have been very clear that we should remain as a hospital providing emergency general surgery and complex general surgery. That means we should be providing specialist care in the sense that Healthier Together is consulting on. That doesn't mean to say that we're not working really strongly in partnership, and we are in fact not only putting a response to the consultation from the Foundation Trust, but we're also working with our partners in the southern sector to put a joint response in. Now, we think that it is really important that we are physically based as the specialist centre because mainly of access issues, and our patients who are in the High Peak in the north part of Cheshire and in Glossop will not have ease of access within the travel times that Healthier Together themselves talk about unless we are the specialist hospital site. So it is really important that you have your say. There is a document which is available in GP surgeries, is online on the website and throughout the hospital and our facilities in the Foundation Trust. Please have your say and ensure that we remain the provider of emergency surgery for the people that we serve. Regarding accident emergency services, we continue to deal with high numbers of patients attending the department. In fact, for the year to date, we're 6.5% above in terms of those attendances. I'm pleased to say, however, that with the changes that we're making, both within accident and emergency and throughout the hospital, our patients are having a better deal. We are seeing fewer breaches of the 4-hour target, and that is something to be very much welcomed. In terms of the things that we've done differently, we've actually extended the hours of the specialist nurses in the department to be able to see people up to midnight, and in the evenings we've actually got primary care input from a GP to also treat those minor injuries. I'd like to take this opportunity to thank everybody who has been involved in this. It's not just the people in accident emergency, in the acute medicine area, but also throughout the hospital and the community that has allowed these important changes to be made. We're not there yet, we haven't proved our sustainability, but I have every belief that we're going to do that, so thank you. I'm really pleased to be able to report some good results in the place assessment. This is where a number of issues around patients' experience, dignity, respect, food, cleanliness and environment are measured very much by an external group coming in, working with the hospital, with governors and with Health Watch to assess what we're doing for patients. In terms of food, we have improved by 17% in the audit over last year. And that's very much down to the brand new patient food trolleys that we have bought and implemented. That combined with our new kitchens, which should be ready come Christmas, ready for Christmas lunch to be served, I am told, will mean that we can sustain that terrific improvement in service. So thank you to everybody involved in that. I'm pleased to say also that we are within the 100 top employers as measured by the Health Service Journal, and considering there are over 500 health organisations involved, that's a real accolade to us. That doesn't mean that we get everything right for our staff, and we continue to do what we can to ensure that they are given all of the support and the right environment and equipment to be able to give the very best patient care. But it shows we're moving in the right direction, and if you're thinking about looking for a job with the organisation, I would hope that you would take that into account. And finally, we've got 2 awards. As ever, we like to commend our staff who go that extra mile. And Joanne Conway, who is our Senior Tissue Viability Nurse, and Dr. Krishna Murphy, who is Head of our Exemplar Stroke Services, have both been recognised by the NHS Leadership Academy. They are finalists in that, and we're waiting to hear later in the month as to whether they've been successful. So keeping fingers crossed for both of them. Very well deserved candidates. Thank you.